It's time now for Wellness for Life Radio. Here's Dr. Suzanne.
It's normal to feel depressed once in a while, but if you're sad and blue most of the time and it's really affecting your day-to-day life, you may have clinical depression. Now, there are many different types of depression. Maybe you had a death in your family or recently lost your job, and this is considered an event-related depression. You can have depression from a traumatic brain injury and inflammation of your brain. Another type of depression can be from a shift in your brain chemistry due to poor nutrition. But there is a very unique form of depression that's been overlooked by many called perimenopausal depression. And we have Dr. Eldred Taylor here today to share strategies on how to find relief from this condition. Dr. Taylor is an expert on functional and anti-aging medicine and is the co-author of 2 must-read books, Are Your Hormones Making You Sick? And The Stress Connection. Great to have you here on the Wellness for Life show, Dr. Taylor.
Thank you so much for having me. I'm looking forward to the discussion.
Yes. Well, let's start out clearly. What's perimenopause and what are some of the symptoms that we've got to look out for?
Well, perimenopause is the stage when women are exiting their reproductive stage. You can think of perimenopause like puberty in reverse. So when a woman is going through puberty, she is going into her reproductive stage. She's going into the phase of her life where she's going to have menstrual cycles, and those menstrual cycles are governed primarily by 2 hormones, estrogen and progesterone. And so in puberty, your ovaries are trying to get into a regular cycle, and in perimenopause, you're trying to exit that reproductive stage. And whenever you're going through a transition, there's going to be turbulence. And you get turbulent hormone balance. And that turbulence and that inconsistency in hormone balance in both of those stages, they can cause a lot of emotional and physical symptoms. And because hormones have a direct effect on the mood in women and men, they've probably experienced that if you're married. I've been married for 34 years. And there are definitely emotional ups and downs that are associated with those hormonal ups and downs. And so women get anxious and depressed during that period of their lives. But that can be remedied if we can, or if a woman can, with the help of either herself or with the help of a healthcare provider, put those hormones back in balance. So usually perimenopause starts around age 35 to 40. And it goes to around age 50 or 55 until the point where the woman has stopped having periods at all. And also because of that turbulence in the hormone balance, they can get irregular periods. They can go anywhere from skipping periods to having prolonged bleeding or having multiple periods in a month. It's just very unstable time. And if any of the women have gone through it themselves or they have prepubescent kids that are going through it, they know it's a turbulent time for everyone who's involved.
Great. Thank you for clarifying that. But, one of the things that I always look at, okay, perimenopause is for women, but I really believe that there's such a thing as like a periandropause for men. I know we're going to go into depression and perimenopausal depression, but I'd like to ask you, for the men out there, listening to the show, would they also have similar types of symptoms?
Well, men don't have menstrual cycles, so they don't, and their hormones really don't go in a cyclic phase. Their hormones are more on a consistent basis, but you can definitely have a decrease in testosterone as you get older, and men can lose some of their vitality. They can have fatigue, and they can have emotional issues also because testosterone, it gives them a sense of well-being. And so if they don't have enough of that, you may see them dragging around the house. They're not as active. They're not playing golf like they used to. And they can be irritable too. So I don't want to say it's, it's totally a female issue. I always say getting older is not for sissies. It's a tough time for men and women to get, as they get older. And sometimes those changes can rub each other the wrong way. And, issues can come about due to that.
Thank you. Thank you for clarifying that. Let's go into a little bit of this depression, because that's what this today is all about, is learning more about depression. What's going on, especially when you are in the perimenopausal state and the hormone shifting? What's going on with our brain and our mood?
Well, what's primarily happening? Uh, See, there's a lot of, I was trained as an OBGYN, and we were taught that as women get older, it's always an estrogen deficiency problem. And that's been proven wrong from the Women's Health Initiative and several studies. And even just physiology, it's really not a decrease in estrogen. There can be some decrease in estrogen, but your body has other ways to make estrogen. Fat tissue can make estrogen. There's other tissues that can make estrogen. What definitely goes away when you are menopausal or perimenopausal is a deficiency in progesterone. And progesterone is called progesterone because it promotes gestation. And progesterone is made primarily in the second half of the menstrual cycle, the second 2 weeks of the menstrual cycle. And progesterone is a very calming hormone. It binds to something called the GABA receptor in the brain. And that's why women who get PMS and they get depressed a week or two before their period, if they're not making enough progesterone or if it's too much estrogen, they don't have enough GABA for the receptors in their brain, and so they can get anxious because GABA is a very calming hormone, and that anxiety can lead to depression. Now, I won't say that estrogen has no effect on the brain because estrogen also helps to potentiate the activity of serotonin, and most people have heard of serotonin. Serotonin is kind of the happy neurotransmitter or brain chemical, and when anybody takes antidepressants, it's actually to try and make serotonin more effective. It doesn't necessarily increase serotonin, but it tries to make low serotonin levels last longer. So that's primarily the issue in perimenopause because we have such a turbulent time with balancing estrogen and progesterone, and they have such an effect on your mood. That is really the cause of perimenopausal anxiety and perimenopausal depression. Now, most doctors treat it with antidepressants, but a better way to treat it is actually to treat the cause and to try and balance the hormones, and then the moods will take care of themselves.
Which you just mentioned the causes, the imbalances of progesterone relative to estrogen. So do you start with progesterone? So do you prescribe progesterone, or do you recommend women to go to the health food store and get the wild yam natural progesterone that they can apply on their skin?
Yeah, well, now actual wild yam is difficult to be converted into progesterone. You want it to come from wild yams, but you actually want the progesterone. Now, if your doctor is not willing to, go along with this, yes, progesterone does not hurt you. Estrogen can hurt you. Progesterone helps with decreasing growth, and it helps with the mood and PMS. Estrogen can hurt you. That's why you can't usually buy estrogen over the counter, because it can cause abnormal growth. Now, if you want to, yes, you can try progesterone. I really would like for you to find a healthcare provider who could help you with that. But the best way to do it and to know what to do is to actually have your hormones tested. And I believe one of the best ways to test hormones is through saliva. And again, I did an OBGYN residency at Emory University here in Atlanta, and we never measured hormones. We never measured hormones in the blood. We never measured hormones at all. We just gave young women birth control pills for whatever ailed them, and we gave postmenopausal women estrogen at that time. And we never tested, and that always was a question for me. And the reason why you don't test hormones in the blood is because hormones are fat soluble, and when they're in the blood, they're bound, they're like packaged, and they're really not available to the body. You have to look at what is free hormone, and only about 1% is free. And in order to figure out how much is actually being delivered to the tissue, you need to take a sample from a tissue. And the saliva gland produces saliva, and it gives you an idea of how much hormone is in the tissue. So the best way, I believe, to figure out if there's an imbalance and how to correct it is to actually have saliva testing so that you have some documented information. And me learning about how to measure hormones through saliva really changed my whole career. That's why I wrote that book, Are Your Hormones Making You Sick? Because before that, and even now, doctors just give birth control pills for any type of hormonal issue for young women, and that's not the best answer, and it definitely doesn't diagnose exactly what is going on. So, yes, progesterone, if you have to, just go to the health food store and get progesterone. It's not going to hurt you. You can see if it's going to help you. But I'd really like for you to see a healthcare provider who can actually test your hormones.
Fantastic. Saliva hormone, I totally understand that. I haven't done saliva in a little while. I usually do the dry urine testing. But in salivary testing, is it still the same when you do take progesterone and cream transdermally that the salivary does not, it's not correct because the level would be much higher regarding progesterone?
Yeah, that is partly correct. It's according to, if I am going to test somebody who's taking transdermal progesterone, then what I'm going to do is I want them to be off of the transdermal progesterone for at least 72 hours. Because when you take it transdermally, what happens is it can build up in the tissue, okay? So what I want to know is that if you've been on it for 2 months or 3 months, what I want to know is, if you've been off of it for 3 days or 4 days, is there a lot still left in the tissue? So you're right, if you put some cream on and you do a saliva test 2 hours later, or even later that day, you're going to get a high amount in that saliva test. You need to let them be off of it so you can see how much is building up in the tissue. So I've been doing saliva testing for 20 years, and it's just a matter of understanding the biochemistry or the pharmacology of it. You can't test immediately after someone has taken a dose, or even a day or two after they've taken a dose.
Thank you for that. Thank you for clarifying that. Which lab do you use? Which salivary testing lab?
Well, over time I've used several. I use primarily Labrix because it's a little less expensive. But there's several good labs. ZRT is a lab. Genova is a lab that you can use. ZRT actually allows you to buy them over the internet, so you could actually, do it without a physician if that's what you wanted to do. But Labrix is a great lab, and Genova. Those would be my top three.
Thank you. So regarding depression, how often do you see this in perimenopausal women?
You see it quite often. I'm just guessing. I would say 30–40% of the time. And sometimes it's not necessarily categorized as major depression. It's just women don't feel good. My wife is actually a psychiatrist, but she practices functional medicine with me now. But when she was in psychiatry, before we understood all of this, she would say that she would see all of these women between age 40 and 50 that she was putting on antidepressants, and she was labeling them as bipolar. But now she's learned that these women really had hormonal issues, and if you fix the hormonal issues, that all of their psychiatric or emotional issues went away.
I can see that. I treat a lot of women in that age range. For one, I've already gone through menopause, but during the time when I had this head injury that pushed me into early menopause, boy, depression was a huge, huge symptom. Depression and anxiety, it just goes back and forth.
Right.
So I know that helping my adrenal glands, supporting and having a good hormonal balance, it made a huge difference in relieving that depression. I don't have depression or anxiety anymore. Let's go ahead and talk a little bit about your client. Let's say a woman comes in, she's in the perimenopausal, you test her out, and you find that, from salivary testing, she's definitely low in progesterone, and then you start implementing progesterone. Is there a cycling that you do, or do you recommend doing it daily? And then what other therapies or modalities do you use to help with the depression?
Okay, so a person comes in and they're perimenopausal. If they're still cycling, then I want to try and uh, do the saliva test 7 days before they're expecting a cycle. Okay, so you want to do it like on day 21. If their menstrual cycles are irregular, then we just test, because if they're having irregular cycles during this time, it's usually due to too much estrogen. So I want to know how much estrogen they're putting out, so then I know how to dose the progesterone. If their problem is primarily irregular bleeding, I will try and use transdermal progesterone 2 weeks on and 2 weeks off, because a lot of times that will help coordinate the bleeding, because your body normally will bleed after 2 weeks of progesterone, it'll have a regular period. So I'll try to do that to have some type of regularity to their cycle. So yes, it's 2 weeks on and two weeks off. If bleeding is not that much of an issue, and anxiety and depression is more of an issue, I like to use oral progesterone, because oral progesterone actually breaks down into something called allopregnenolone in the liver. And allopregnenolone goes across the blood-brain barrier, and that is what binds to those GABA receptors to help with the depression and the anxiety. Because a lot of times the depression is due to the anxiety. So if you can get the allopregnenolone to bind to the GABA receptors, the anxiety goes away, and usually the depression follows. Also, what you see in perimenopausal women is their inability to sleep. And oral progesterone helps greatly with helping these women to sleep.
Oh, great. Gosh, you were so clear on that. So it really depends on the woman and customizing it for their cycle, how they are dealing with it. And then, Dr. Taylor, you've talked about 5-HTP. You have a formula called serotonin. L-theanine is really good for helping with anxiety, and utilizing adrenal glandular supplements and botanicals to boost the adrenal glands and strength to help you deal with stressors. Is there anything else that we can think about? You think that how we can ward off depression? I love exercise. Do you recommend exercise as part of your treatment plan?
Oh, sure. Yeah, exercise is great. The only thing that I caution women when they're trying to exercise to get out of depression, if their adrenal glands are not working properly, they have adrenal fatigue, exercise is actually going to be another stressor. So I always ask women, okay, if you're exercising, do you feel better after you exercise, or do you feel worse after you exercise? Usually if they feel worse after they exercise, it's another stressor, and their adrenal glands so they may have adrenal fatigue. If they feel better, then yes, it's a great stress reliever. And I always, try and, I don't necessarily want my depressed patients to go out and try and run a marathon or, overexert themselves. But yes, mild to moderate exercise is a great stress reliever, and, it can stimulate endorphins, and yeah, it can definitely elevate the mood, and then they feel like they've accomplished something. So that sense of accomplishment is also something.
Thank you so much, Dr. Taylor. I'm so sorry we don't have enough time to go over everything, but we've learned so much on why it's so important to be able to look at the hormone differences, especially your progesterone level. As we are going into our 30s, 5 to 40s and 50s, our hormone level has a big impact on the depression, and that we want to balance that out. We definitely want to use testing done, and you like to use saliva testing. And there's also estrogen that it can help you manage your anxiety as well, and depression, but also for the fact that if you use the progesterone at nighttime and you take orally, then you're definitely be able to sleep better too. You also mentioned that there's L-theanine, super important, and 5-HTP to also enhance your depression or actually reduce your depression and help you feel better. And then often glandulars and botanicals will also be helpful. There's so much information here, and you can definitely go and see Dr. Taylor's website, taylormedicalgroup.net. Taylor taylormedicalgroup.net. And he also has a supplement formulations called taylormdformulations.com. Got a lot of good information. I know if you can share this information with all of your friends and women who are going through the change, it will definitely change their life for the better. Please subscribe if you haven't already, so we can continue to do our very best here on Wellness for Life. If you need more help, and you need to contact me so I can help you with it through phone and Skype consultations, then you can go to my website, drsuzanne.com, and I'll be able to do that. Until next time, go out there and live your best life today, full of energy, enthusiasm, and ultimate health and wellness. This is Dr. Suzanne sharing natural strategies on the Wellness for Life show right here on Radio MD. Thank you. Stay well.